This is Impact Healthcare.
Attention. This podcast has been disrupted.
Hey, welcome back. Actually, it's not even welcome back. It is welcome to. We have rebranded this podcast from the Impact Healthcare Podcast to the Dysrupt Healthcare Podcast. And you will notice one of the coolest things I think that we did, and I will take credit for that, you'll notice Dysrupt is spelled wrong on purpose because we are tired of people focusing on themselves. And rather focused on the why we all get out of bed and try to disrupt healthcare. And so I am super pumped to have our guest, Miss Kimberly Carlson. Kimberly, for those people who don't know who you are in your great company, give us an introduction.
Absolutely. Thank you for having me, Lester. I really appreciate it. My name is Kimberly Carlson. I am U.S. Speaking. I am CEO of U.S. Speaking. We are can we start that over? Okay.
I can, absolutely.
Yeah. Sorry.
Oh, no worries. Remember, anything we do, you can do that. And then two,
you'll bleep it out. Yeah.
Well, and nobody cares. Like,
I know.
I promise you, like, the best podcast
or when there's
stuff, it's just when it's real, like,
yeah.
You know, like, you can drop the F-bomb. I like, literally, like, this is real. This is real stuff.
We're good, Dan. I'm good. Personality right here.
There you go. All right. Welcome to the newest episode of what I'm really excited about is the new branding of our podcast. You'll notice that we went from the Impact Healthcare Podcast to the Dysrupt Healthcare Podcast. And no, that is not a misspelling in Dysrupt. We did that on purpose because we were kind of tired of everybody focused about how things would impact them or how much money they could make, and they forgot the why we do this. And so Dysrupt with a Y is all about remembering why we get out of bed and fight the good fight. And fighting the good fight alongside of us is our guest today, Miss Kimberly Carlson. Kimberly, for people who don't know you and never heard your wonderful company, give us an introduction.
Thank you, Lester. You have me pumped about the Dysrupt and the why. So I am Kimberly Carlson. I am CEO of U.S. Beacon. We are a medical claims integrity review company. What does that mean? We review medical claims. We find ineligible charges that are under CMS federal coding guidelines. We remove those and we send them to be paid. We save our clients money. I started this business when my husband was diagnosed with stage 4 cancer, and I had to become his biggest advocate. Started noticing bills coming in the mail that I truly didn't understand. So we formed a company that works for people like us and employers that have people like us.
So, Kimberly, to start off, I think I want to kind of address a question that I remember the first time reading a stat around the question I'm about to ask you and thinking, there's no way that this is the right answer. But if we were just saying out there in general, generically speaking, what percentages of bills have some sort of error on them?
In our experience, Lester, this is U.S. Speaking's experience, 99% of the claims we have reviewed have had an error, whether it be a $5 error, a $10 error, or a $100,000 error. We have found one clean claim.
So what's really interesting, I read, and we did not rehearse this, I read a stat that was, it said over 90%, and I was like, there's just no way that it's that high. So you're confirming that. So maybe to kind of, start the conversation, we review kind of how this all happens. So I go access healthcare. My doc, the hospital, does their stuff, right? Sometimes the doc's writing some things down. Sometimes they're inputting something. Sometimes they're even dictating something. And then that goes somewhere, and I walk out, they sometimes charge me something, and then 3 weeks later a bill comes most people don't review it in the first place. But like, talk to me about if it's 99% of this, how is it this bad? Like, how does it get that bad?
Well, I don't think it's anyone's fault necessarily. I think that the hospitals are packed, they're understaffed. We're growing these conglomerates are growing so huge. There's so many different intricacies when billing. You've got the medical coding department, you've got the surgery department, you've got everybody throwing in these codes. They get put into a bill and it gets sent out for payment because they're running so many patients through. I don't necessarily think it's anyone's fault. I think that it's just a complex system.
So when you think about it from the complexity of that, you and I are nerds in the business, so we kind of understand
That's bigger.
when we say complexities, how complex it really is. But talk to me about and go into detail about that complexity, because I don't think anybody would really understand that a code might mean this on Monday, but something else on Tuesday. And depending on if you're billing it to the green carrier, the blue carrier, or the red carrier, it could mean something else. Talk about the true complexities of why this is even harder than maybe the average person listening to this thinks.
Sure. So every carrier has a contracted rate with hospitals. Every rate's different. So you're going to find that within the contracted rate, which we cannot mess with the carrier's contracted rate because that's a private proprietary rate that they have with the hospital that we're not allowed to see. So one, you're not going to know that your bill may be $12,000 for a semi-private room for one night, and you may think that's wrong, but it's the contracted rate that's within there. But when you start having a surgery and you've got a price for it, then you start unbundling each one of those CPT codes, which the CPT codes are the codes that they use for acknowledging each procedure. When they start unbundling those, they're already built within that one CPT code. So those are extra charges on your bill that should not be paid for or should not be eligible. So I think that one, they're constantly changing their billing systems from whomever, whichever person. A lot of the coding people will send you to another department, or they don't know which department to go to get these itemized statements. Some even don't even know what an itemized statement is. They'll send you a UBO4, which a UBO4 is your uniform billing bill it's just kind of lining out what's on the bill, right? Typically, it's your itemized statement you want to get, and you never receive that unless you go and ask for that. And that's where you see all of the breakdowns of these codes that are outside of the regular code that is billed, that you find those out.
I want to break this down, and I'm going to try to dumb it down for the audience. So let's just pretend that this whole conversation was we were going to see a mechanic.
Sure.
And, a mechanic, the unbundling versus bundling, a CPT code would be the equivalent of saying, hey, I worked on your alternator or your brakes or your whatever. And in that scenario, a bundled would say, hey, the alternator and all the things I did underneath the alternator is going to cost you $800. But sometimes you're getting, I billed you for the alternator, and then I also billed you all of these other things that should have been under this thing. But since you don't know how to read this, nor are you asking all of the right questions of the consumer, I billed you the $800, and then I billed you pieces of it on addition that were supposed to be included in the $800. Did I summarize that?
That is exactly how it is, Lester. That is, you go in thinking you're going to pay one price, which really you're not sure in healthcare what price you're going to pay. But that's a great example of, we're going to bill you for this, but then let's break down everything. We use this tool, we used a screwdriver, we used pliers, whatever else,
Right.
And we bill you for those too.
You know what's crazy about that is I usually make a joke about the only two industries that you consume the good or service before you know how much it actually costs is healthcare and a mechanic. And I just by accident put those in the same exact category. Like that's where most people feel kind of the most vulnerable, right? I have no
Right.
idea how much this is going to cost over here. And at least me, when I go to the mechanic, they could tell me something's wrong with it, and I'm completely not handy enough to even understand if they were saying it right or not. So that unbundling, and then I want to go through that itemized bill. So you're saying that as a patient, I can ask that hospital for an itemized bill, and that should break down not the bundle, but all of the things that come down to there. And is that my right as a patient? Like, I can ask for that and they are obligated to give that? Or is there some sort of hoop I got to jump or magic phrase that I have to say, or I got to know the right person?
You have every right to go get your itemized statement. You have every right to designate someone, as long as you sign a HIPAA form, for them to go and get your itemized statement. By law, this hospital has 30 days. Most states it's 30 days. Some it can be 10 to 15 to provide you those documents. If not, you have a right to go to the DOJ or whomever to turn those in, because it is your right to review what was paid and how it was paid.
So it's interesting because I always try to ask myself, as somebody who loves this business, and I know you do as well, what's the so what behind it, right? So, like, if I am a consumer of healthcare, why do I care, right? And I think about this. Most plans have some sort of deductible and out of pocket max to hit. If I'm a consumer, right? So, hey, if I have a $5,000 out of pocket, that means all of these codes that are being inputted are making me pay that $5,000 or more. So is that why everybody listening to our voice right now should care? Is like their financial out of pocket, how much they would pay for some particular thing, is in jeopardy here?
That's exactly right. Not only that, but think about how your premiums are going to rise the next year because of what you spent this year. So there's so many facets to it that can affect your spend and how much is going out within your self-funded plan.
I want to make sure everybody understood what you just said, because the average consumer doesn't realize that your premium that you pay, whether you're fully insured, self-insured, whether you're the CEO or the janitor, you are paying some sort of premium. What's coming out of your pocket, and also what comes out of your pocket when you go see the doctor, the hospital, whatever, that number is highly predicated around the amount of dollars that were spent the year before. So everybody that just heard your voice should take that into consideration. It says, wait a second, if I look at my bill, not only could I save money today, it's preventing potentially absorbent increases year over year, because in fact, like 99 in your experience percent of the bills are wrong. That's just exacerbated every employee, every consumer, every transaction, every visit, everything.
Exactly, Lester. And going back, when we talked about how hospitals are complex, I was on the phone with an employee, and this is not the employee's fault. I don't like to put blame on anyone, but the consumer, the patient, this is how complex it can get. I'm asking for an itemized bill from an employee at the hospital that was the supervisor over the billing department. And I asked her if she thought it was fair for $12,000 a night for a semi-private room. Her response to me was, well, I really don't care because I have insurance. And that right there, because most do not understand that those prices can affect you long term. Not only do they affect you now, but they can affect you long term as well. So patients don't understand how important it is to review your claims and make sure that every dollar is accounted for.
So if we're talking to now employers, right? And employers have the choice, depending on the state, depending on the size. I'll caveat that, although size is debatable. to be fully insured versus self-insured. In a fully insured arrangement, what happens if and when there is billing errors, and how is that different from when somebody is self-insured?
Well, with the fully insured, we don't review fully insured. The fiduciary is the network, right? Carrier. So there's a big difference. If a self-insured, the employer is the fiduciary. The plan administrators, sometimes they can bring CEOs, CFOs, board members into these lawsuits if you are not facilitating your funds properly.
So let's now revert that back. I can't do anything about it if I'm fully insured. So if I'm unhappy with how much I pay for healthcare today, and I'm continuing to be in a fully insured plan, one of the things that we should take into consideration of what you just said is who is the fiduciary? And if the carrier is the fiduciary, one side of somebody's logic would say, well, wait a second, the carrier wants to keep as much claims dollars in their buckets, but unfortunately, the minimum loss ratio rule doesn't allow them to keep all of that. So theoretically, if what I call premium, I also call that revenue, I'm going to want rates to continue to go up and go up and go up because a portion of that I keep. If you're self-insured, you use the magic F word, and that fiduciary conversation. Hey, I don't know why I just had a light bulb moment. If 99% of the bills are incorrect and I am the fiduciary on my account, and if we use the F word, or we just say you are the financier, or however you want to look at whatever F word you want to use, the reality of it is that means 99% of the time, the dollar I put on the table to pay that claim is wrong. And I can keep a portion of every dollar if I just did a better job reviewing these claims.
And think when you save that money, because typically when we're reviewing claims and we're reviewing 10,000 and above of a self-funded plan, 35% of their claims are usually 10,000 and above. Okay.
And 35%
of it
transactions.
Right. The quantity are 10,000 and above. Okay. So let's say, let's take, for instance, an 8,000 member plan.
Okay.
And their spend is $52 million a year. This is the software company. Okay. 18.2 million are 10,000 and above. So we're just reviewing 18.2 million claims because that's what our company does.
Okay.
Out of that 18.2 million, we saved $5.57 million.
I mean, I'm no good at math, but that's 30% or more.
Exactly. So you could save, overall, you can save 10% of your whole plan year of money. The whole year. On just reviewing claims. Now, let's say this, when you have an independent review company, it matters because your carrier may say they have a review company in place, but as we know, that's putting the fox guarding the hen house. Right? Instead of
like McDonald's telling you they have a dietitian.
Got that right. So, that is not always the case. They're charging you 30% on top of that review that they have in place. But they will not let an independent come in and review that or audit that. And when they do, they tell you they don't want to give you the billed amounts. How do you perform an audit without billed amounts? So it's what I'm trying to say.
Let's pause there. I want to make sure people understand these words, these terminologies.
Right.
Billed amount, I always call that the fake number, right? The big number. So everybody who's ever been to the hospital knows they billed you $9 for a Tylenol. That top number is the billed amount. Then there's the allowed amount, and then there's the paid amount. So you're saying that sometimes when you're working with a carrier, they're going to tell you, we're not going to give you the billed amount.
Sometimes it's even the allowed amount they don't want to give us. They just will give us the paid amount. So that, and the whole gist of this is anytime someone's trying to hide something from you, let's say you
Right.
you trust them. If you go to your bank and you tell them you want to look at your account to see what all you've spent, and they say, just trust it.
Right.
Everything's fine. Would you be okay with that?
Or even something that people are used to seeing an itemized bill. I'm going to the grocery store. I got 37 things in my cart, and all of a sudden, the only thing I get to see is that I spent, $139.
Right.
Well,
What to spend?
8 cents or
Right.
87 cents or $8.70 or $87. Who knows?
Or if you go to a restaurant, you want everything on, if you get a $5,000 bill and you just ate a nut burger,
Right.
you know something's not right. So you want to be able to itemize that and review it.
So, how often, when somebody is working with a traditional name brand carrier, do they limit and or get cranky when you're trying to audit? Like, what should people be on the lookout for?
Every time.
I had a feeling that's what you were going to say, but
Every single time we got an independent third-party review company that is not part of their quote-unquote vendor list,
okay.
they refuse. Or they say that is not one of our approved vendors. When you hear those words, you know you need an audit.
Okay, so now let's and I'm really excited that we're having this conversation. So what have you seen some like ninja advisors or ninja employers that are really up on this? What are they putting into their contracts with those carriers or in their RFPs? Is there something that people are doing that is making that situation better for them?
People are starting to do that. They're starting to catch on. I think the awareness that a lot of us are bringing, that disruptors are bringing, people are starting to be aware. I think you're going to see a lot more of it in 2025. There are amendments you can put in to say that you would like independent third-party review. I will say, Lester, I've had a plan dropped on the day of when they told their carrier they wanted a third-party review in their contract.
So the carrier said you are no longer our client.
Exactly. Dropped. And they're supposed to give you 30 days. But yes, that has happened. It's best to, at the beginning of a plan year, if a carrier is saying they will not allow that, find another carrier.
So Kimberly, I gotta ask the question though. If I am self-funded, and I know the answer to this is just fun. If I am self-funded, I am paying my relationship with that carrier. Let's just say it starts with a B for all intents and purposes. My relationship with B carrier is underneath an administrative services only contract, an ASO arrangement. Meaning, in non-nerd talk, I am paying this organization to administer my plan according to the plan documents, the plan design, the SPDs that I put into place. Why I'm paying them $38, $52, whatever it is, dollars per employee per month. Whether they get 10 claims wrong or 50 claims wrong, they're still getting paid. Why don't they have their britches in a bunch? Being a Southern girl, britches in a bunch. Why?
I know that well.
Why? Why do they even care?
Because they're going to get switches on their britches if someone comes in, because they know that they are not reviewing those claims and they are charging you 30% on top of that. The best thing you can do as a self-funded plan is find an independent TPA or direct contracting or whatever, but don't allow someone that is paying your bills to control your bills.
So I'm going to give everybody a ninja technique I used to use when I was an advisor. You could steal this too. In the RFP that we would send out to the carriers, we would typically, and I did this more from getting my data to be able to do some reporting and getting my data in order to integrate on-site clinics because I was a big on-site clinic guy. But it's applying to this same thing. And one of our biggest units inside of Willis when I worked there was an auditing team. And they would teach us that you put in the wording of the RFP, in a condition to win this bid, you must agree to these terms. And it was, I need this data in this format on these frequencies. I need to be able to do this. And so in this scenario, I need to be able to audit and have the descriptions of the audit. So again, impromptu, you and I didn't describe this or rehearse this. Is that something that you're like, hey, if you were going to get a perfect request, you could give us some language and we can kind of show that in the show notes, and maybe like people can come to you and get that little thing or something?
Absolutely.
All right. I'm going to put that in the show notes. I'm going to write this down and I'm going to make a link, and you and I are going to create some page that says, hey, make somebody agree that they're going to allow an audit. And this is the wording that you're going to want to use in order for you to know that you're going to get the best availability to the data to be able to do the very best thing.
Another thing I would say too, in those show notes, we want to make sure that you're billing under CMS guidelines. If it is not under the CMS guidelines, the federal coding regulations, the NCCI edit, and all of those that were established for Medicare, not saying you're paying Medicare rate, but you want those procedures in place, because I have seen hospitals, when I was able to obtain contract, pay for robotics, $70,000. Well, per CMS guidelines, that is part of the hospital equipment, so it should not be billed separately. But some carriers will put that they get a certain percentage of robotics. They'll put these things that they know they cannot bill, and I actually posted that contract one day and got a cease and desist from
I would imagine that you got a little Christmas present from somebody. Yeah.
I did, and I didn't really pay attention to it. But anyway, so make sure that you are putting those to establish that you want guidelines within your billing so that they can't sneak something in that should not be billed.
Interesting. So in that scenario, the carrier, were making a financial benefit off of the billing that was a robotic that they kind of don't have anything to do with because they're the carrier and this is the healthcare provider.
Correct. $70,000 benefit from it. Yeah.
Right. On one surgery.
One surgery.
Yeah. Wow.
And robotics is part of that'd be like paying for your hospital bed. That's
Right.
part of the equipment at a hospital. So
It's like if they charged you extra to sleep on a pillow at a hotel.
right, exactly.
I feel sometimes when you fly those budget airlines, they're like, oh, you want to pick your seat?
Yeah.
Even in Europe, some of them charge you to go to the bathroom. So that might be
Right.
the thing there. So 99%, I barely get to do it. This is just nuts. So let's dig into like, what are you typically finding? So 99% of them have an error. In this example, you said 18.2 million was claims over that 10,000.
Mm-hmm.
They saved 5.7. So what did the carrier say to that 5.7? Did that client get all of that money back?
They did. A lot of these, Lester, we're doing prepayment.
Oh.
We are hooking directly up to it. That's why it's important to have an independent TPA or however you're going to do it so that you can hook up directly and be able to get that claims feed. And that's how the payment should be made. Once it's adjudicated, you send it through the audits and then you send it out to be paid. You make sure that claim is clean before it's paid.
Yeah, I mean, again, let's put this in real talk, right? It's like, hey, I know that when I go to Nordstrom's, I am going to pay $87 for that shirt, not that the shirt's going to have a 50% sale and I don't know 50% off of what. I know that it's $87 before I actually put my credit card out, which it's so funny that, when we have these conversations, it's almost like people are like, wow, I've never heard of, or I never thought about this, or man, I'm scared to ask. But like, it would be asinine for us to like hand over a credit card to somebody that doesn't know how much you're going to swipe it for.
I can't remember who it was, but they made a great analogy. Do you go and buy a car? Okay, you're at the car dealership. You hand them a check. You drive away with the car.
Right.
And then let them write for however much they want to write it for.
Right.
Oh, those are things you don't do. So healthcare is the only business run this way. You have to figure out and know how much you're paying, how much they're charging you for, what they're charging you for. I mean, you can see males having a baby, or I had a birth, and the dad that was in the room got charged like $15,000. So we finally got that
viewing fee or something.
I guess, or holding the hand of the patient. I don't know what it was. Did he pass out when he saw the baby come out? I don't know. But he wasn't supposed to be charged. So we got that taken off. But you just have to watch every single claim.
So I want to kind of tail this off. And is there, you said the software company, any other kind of case studies that people can, that you've got in your head that's like, hey, we've done this on other people and these are the kind of results that they're getting?
Yes. So I have a small city.
So that public sector entity that, by the way, doesn't create widgets. Like, this is taxpayer dollars.
Exactly. Yeah. Right. Okay. So we did an audit. Okay. So, and we're still collecting, but 1,400 members are on this city plan. Their spend is around $9.1 million. So that means we were able to review $3.2 million that were reviewable. That means 10,000 and above. Okay.
Mm-hmm.
We were able to find $1.2 million in savings.
So that
overpayment. They overpay
40%.
Mm-hmm. And we're still working to recoup that. That's why I say prepayment is the best, because as you know, being in the business, clawing back on money is extremely difficult. It can take a year or two, and it's a lot of work. It's a lot of nagging. Now, I have been told by my husband I'm a professional nagger, but, and I take that very seriously, but we do go back and try to claw it back. Sometimes we're successful, sometimes we are not, but we have been successful.
And a lot. Kimberly, are you ever successful on that prepayment, getting that in place with a major carrier? Or is this like, hey, in order to get that done, you got to have an independent TPA?
You have to have an independent TPA. We've never, and I would tell you that if there is one that's in with a major carrier, they're not independent.
Right. Of course.
They're not reviewing your claims probably the way you would want them reviewed. And I'm not trying to bash anyone. And
look, I mean,
the way it is.
I think about this. I'm sitting at a client who's a hospital, and I like to think, let's say this, whether I'm Pollyanna or not, I like to think that people aren't doing this in order to screw other people, especially the people that are on the ground doing the job. Like, the model has just been broken and built incorrectly, and has been built, as Chris Deacon says, for revenue extraction, number one, and two, for masses of amounts of efficiency, right? Like, the hospital has to create processes in order to see a bunch of patients. The carrier has to build processes in order to process a bunch of claims, and everybody's trying to do so with the least amount of cost with the most amount of profit. And so, like, we can't get mad. Right. All of us who own businesses, I want to make the most amount of profit as well. So, like, I get it. But it doesn't have to, be that way. And what's interesting about it from the third-party administrator standpoint is, like, if somebody said, hey, I'll give you the non-transparent way and the way you can't audit anything, and I'll give it to you for $1, And if you are wanting the transparent way and the way you could audit, you got to pay me $1.25. Everybody would take $1.25 in a heartbeat because
Right.
I get that I'm asking you to do more work. I'm really asking you to do it right, but that's beyond the point. Like, there's a lot of human error that go into this. Last question, and then I'll let you go. How do you see, or are you already seeing AI and blockchain and some of these new technologies potentially improving this whole scenario?
Well, I'm not an AI person. I am not an engineer. I want to back up real quick, though, Lester.
Okay.
Our appeals rate is less than 1%, and we have never lost an appeal because we strictly do it by you can review these under federal guidelines and coding. And if you put that in your RFP, you're protected by doing that. So anyway, let's go back to AI. I am not our engineers guy. I will tell you that. We have a very smart set of guys that works our AI. We built it our own system. But I see it playing a huge part in the future. I
Even
think
if it's just obvious stuff like a male can't have a baby, or you had a heart procedure, so you're not doing a screw for a knee in a heart procedure. Like, just
exactly.
like that, which is, it just makes it obvious. This is amazing. If somebody hears this, that is a self-funded employer or an advisor who says, you know what, 99% of claims, and these case studies are generating 20, 30, 40, 50% savings. If somebody wanted to get a hold of you and learn how to do business with you guys, where do they find you? Where do they find US Beacon?
Sure. So I'm on LinkedIn, Kimberly Carlson, and also at our website, us-beacon.com.
And last thing, does US Beacon mean anything? Where'd you come up with the name?
Supposed to be a beacon of light.
Okay. I figured that.
So a beacon of light for healthcare. I don't know. My husband went through stage 4 cancer, and I had to become an advocate for him. So through a lot of darkness, we wanted to bring light. So that's where we came up with the name.
I love it. I love it. Well, thank you for being a beacon of light for the rest of us and anybody who's going to listen to our voice. We will follow up with you about the show notes to get that stuff on there, because I think the more we can empower people with knowledge and tools, the more likely we are to get all the things that we want to do, which is just helping people. I mean, at the end of the day, that's all we're trying to do. So thank you
Absolutely.
for being a guest on the show.
Thank you, Lester. I appreciate it. It was fun.
Thanks, everybody, and all the listeners. If you got any value of this, hit share, send it to somebody. This isn't about, saving just organizational money. This gets down to the individual consumer so everybody can benefit. So hit share, hit like, and we'll see you on another episode of the Dysrupt Healthcare Podcast. Thanks so much.